Thank you, Brian, for that wonderful introduction. And Mark, thank you for reminding me how painful it was to be a nerd in high school. And it was. As you heard, I'm a Miami native. Born here, bred here, grew up here. I began my educational career at Coral Way Elementary School, working my way up to Ponce Junior High and then Gables High and then University of Florida for my medical degree. So I'm a true native. Not only that, my mother lived here all of her life. She was born and grew up in Florida. My son was born and grew up in Florida. And it's actually through my mother's experience that I first learned about Baptist. She moved from our home in Coral Gables, where she lived for 50 years, to be one of the first residents at the Palace in Kendall. And Kendall's just right down the street from Baptist Hospital. Now, I don't know what happened, but her apartment was right next to the furnace room at the Palace. And she developed carbon monoxide poisoning. Now, I don't want to say they tried to bump her off, but she was then taken to Baptist Hospital. And so I made very frequent trips coming back, and I discovered the incredible care that the Baptist system provided my mother. And she lived until 4 years ago and has been a beneficiary of the health care in the Baptist system. The other part of my story is, as Brian told you, my training was as a surgeon, particularly as a GI surgeon, gastrointestinal surgeon, cancer surgeon, and particularly a pancreatic cancer surgeon. And the sad irony about that is that unfortunately 2 years ago, my wife passed away from pancreatic cancer. It still affects me. It was because of that that I decided to dedicate the last chapter of my career to coming home and treating my mother. My experience in Boston was one where a lot of people from South Florida would come to visit us at the Dana-Farber or the Brigham, and I know a lot of people from South Florida would travel all over the country for their cancer care. And it was time for Miami to have a place where you didn't have to do that, where the best of cancer care in the world could be delivered in our hometown. And that's our goal. That's our vision. The vision is to make Miami Cancer Institute a destination cancer institute. So about 3 or 4 years ago, when I was beginning to talk to Brian Keeley and Wayne Bracken about Miami Cancer Institute, as they were looking at me, I was looking at them. I hired Deloitte to do a market analysis of where cancer care would be best delivered in South Florida. And Deloitte came up with the Baptist system, and I began talking with the Baptist system about that time. It was because of what I just told you about my wife that that delay occurred for me being able to accept that position. But here we are. The vision now is for Miami Cancer Institute to be a destination cancer institute. You heard that in the video. That is, patients don't have to leave. And even those that are snowbirds, even those that have homes in the Northeast and spend their winters down here, will be able to have the same kind of care initiated in New York, Boston, Philadelphia, and we'll be able to care for them down here. So when I describe Miami Cancer Institute, I describe it in 2 terms: high tech, high touch. Let me explain. So let's start off with the high tech. The key part of high tech, one of the things that we're proud of in high tech is proton therapy. We're going to have the only proton therapy unit south of Orlando and Jacksonville and north of Antarctica. There are none in South Florida, the Caribbean, or Latin America. Let me digress a second and explain a little bit about how proton therapy works and why it's different and why it's important for us in cancer care. So everyone in this room knows that traditionally the 3 ways we take care of cancer are surgery, we cut it out, chemotherapy, we poison it, or radiation therapy, we burn it. And in radiation therapy, the traditional forms of radiation therapy are, let's say this is the tumor. The radiation burns its way in, burns the tumor, and burns on its way out. That's different in proton therapy. Proton therapy is high energy but low energy as it enters, explodes the energy around the tumor, and stops. So there's almost no collateral damage. Normal tissue around it is not injured. A critical part of proton therapy. Right now, there are 3 primary indications for proton therapy. And if you think about it, children, little kids, have no tolerance if you're going to burn something around that tumor. So that's the primary indication, solid tumors in children, because you can't affect the normal tissue around them without affecting their growth. The second is CNS, brain tumors. And the third is spinal tumors. Again, no tolerance if you were to burn areas around it. But expanding that, we're going to see new areas where proton therapy is going to be useful. Let's take an example of a woman with a left-sided breast tumor. Left-sided breast tumor means they get traditional radiation therapy, burns on its way in, and guess what's right behind the breast is the heart. And so it burns on the way in and it burns on the way out. Proton therapy will stop right there and spares the heart the unnecessary radiation associated with radiation therapy. So we think this is going to be an important adjunct to how we're going to treat cancer, the first part of our high tech. The second part of our high tech is personalized medicine. We now have the capability of taking your tumor, your specific cancer, breaking it apart in the laboratory, finding out what mutations cause that cancer, and then directing therapy specifically at those mutations so that you don't get unnecessary chemotherapy, you get appropriate chemotherapy. And the third part of our high tech is our relationship with Memorial Sloan Kettering in New York. We're going to have every single one of the clinical trials that they have available to them in New York, we're going to have available here in Miami. And our relationship with Memorial is not just a branding exercise. It's not just putting their name anywhere on our buildings. It's much more intense than that. We have telephone books worth of checklists that are standards of care, that our standards of care is exactly the same as their standards of care. You start a therapy in New York, you continue that therapy down here, and vice versa. So that's the third component of our high-tech component of that. And we're going to add the newest forms of therapy like immunotherapy. And the reason I add immunotherapy to that traditional chemotherapy, surgery, and radiation is it's the newest way we're treating cancer. And I use as an example Jimmy Carter. 5 years ago, if you had metastatic melanoma, it was a death sentence. Now we have Jimmy Carter, metastatic melanoma, treated with immunotherapy, alive and well. That's the future of what we're going to see in cancer care, and we're going to be able to deliver it right here in Miami. So there are lots of things that I'd like to further talk about in the high-tech world, but let me move on to the high-touch world. As I indicated to you before, I know cancer is a very personal disease. It not only affects the patient, it affects the family in a very intense way. We think you should be treated where your family support systems are. We think you should be treated in the area where you can get the support that you need, and we're going to be able to provide that. So our goal is to provide those kinds of services like cancer support services. We're going to have psychosocial support, mind-body experiences, therapies, integrative medicine, dietary, nutrition, art therapy, music therapy, all the way on to survivorship. We want to be able to take care of patients from the diagnosis to the treatment, on to the complications, to survivorship, and then even end-of-life care as you will need it. The second part of the high-tech or the high-touch part is what I call multidisciplinary care. And I was able to do this at Dana-Farber. It didn't happen on day one. It's not going to happen in January 16th when we open. But by this I mean someone who has a newly diagnosed cancer needs to be seen with not only a surgeon, but with a radiation therapist, a medical oncologist, and let's just take someone, a newly diagnosed woman with breast cancer. She should be seen by a surgeon, a medical oncologist, a radiation oncologist, and maybe even a plastic surgeon for reconstruction, all in the same setting. That's our goal. Again, it won't happen day one, but that's where we're going to go. The third part of that is that we want to be able to offer the immediate forms of treatment. By that I mean is if you have a newly diagnosed cancer, I don't want you to wait around for 2 weeks to get your first appointment. I want to be able to make that appointment the next day if you want it. Now, it took us a while to do that in Boston, but we were actually able to deliver that. So a woman with a newly diagnosed breast cancer, she doesn't want to wait 5 weeks or 5 days to several weeks. She wants to know what the therapies are going to be, and we want to be able to deliver that. In this new paradigm, we are going to be a hybrid cancer center. And this is a new concept for actually the U.S. 80 to 85% of cancer care in this country is delivered in community hospitals like ours, not in teaching hospitals and academic centers. But the new concept in hybrid cancer care is you take the very best of a community hospital and you marry it to an academic or research setting, and that is the opportunity to bring both together and raise the level of care everywhere in the community. That's what we have to do. So right now, MCI has no brand recognition. My goal is initially for us to get off the ground, if you will, and develop brand recognition in Miami, South Florida, then the rest of the Southeast United States, and obviously part of our community will be the Caribbean and Latin America, and that is our goal. Let me take the last moments here to talk about economic development. It was great to hear about the entrepreneurs and how you think about healthcare in Miami and how this could be an incubator for so many things, because I view it the exact same way about what we can deliver for healthcare in South Florida and how we can become a destination. So when Miami Cancer Institute opens, we're going to have 1,200 new jobs, and of those, we're going to add an additional 200 professionals, medical professionals, both nurses and physicians. And we're going to add that to the Baptist system, which currently has 16,000 employees. Not only that, Baptist system contributes over $2 billion to the local economy. It's an interesting observation that ACA, Florida's Agency for Healthcare Administration, estimates that in Florida, there'll be over $6 billion worth of medical tourism that could be attracted to Florida from outside of our region, maybe even outside of our country. And so when we join with our colleagues and neighbors in South Florida, like University of Miami, Julio Frank, a colleague of mine from Boston, Steve Altshuler, someone I've known from CHOP, who's going to be, who's the CEO of UHealth, Steve Sonnenreich from Mount Sinai on the beach, Nicholas Children's Hospital, and Dr. Kinney. We had our partners at FIU, Mark Rosenberg, and our research partners. We can become something that South Florida will rival many of the established places in the country, Boston, New York, Baltimore. Those are the kind of areas that I think we can drive the economic development in this area. And so let me end by saying how proud I am to come home. I want to thank you for my hurricane homecoming. And it's a delight to be here, and it's a delight for you to allow me to come home completely. Thank you.